we see often genetic tests come back for people, and they can have commonly 5, 10, 15 mutations that are involved. In some cases, some that had very excellent response to immunotherapy, as you're saying there, one fellow had 200 mutations come back on his report. And that's not a bad thing necessarily, because this person years later is also cancer-free at this time. So it is really exciting. As you say, the concept of finding out what's going to work and administering it on the surface is simple, but here's where CureMatch comes in, because now that we have this genomic testing, and in 2022, it's starting to become better understood and accepted by medical oncologists on the front line as a very important tool. I appreciated what you were saying also about chemotherapy, and so many of the new treatments that are really providing such great benefit to people have low doses of chemotherapy plus 1 or 2 targeted therapies. So people
Right.
aren't having the side effects of chemotherapy. And I think it's great that you made that point. It was all we had. And so it did its job really well. And for some people now with the right genes or the right molecular background, it can be exceptionally beneficial, and the side effects are practically nil. And with these targeted therapies and the low dose chemotherapy, we're also seeing similar outcomes, which is excellent. So if you're out there listening and you're thinking, chemo, no, remember, you're probably thinking in an outdated way about chemotherapy. As Dr. Kurzrock mentioned, lots of folks it didn't work for, or it gave them some pretty powerful side effects. Whereas now when you're stratified and you know it's right for you and you've got the right combination, you won't almost certainly experience the side effects that we all think of when we think of chemo. So don't poo-poo it if your doctor mentions it. Just make sure that you've got the genomic testing and that it's the right one for you, for sure.